Right, and to begin the conversation, we have a guest in the studio, the Executive Director, National Primary Healthcare Development Agency, Dr. Muyi Aino. Thank you very much for joining us, Dr. Aino.
Thank you, Ruth. It is a pleasure to be here.
All right, building a resilient and integrated healthcare system is part of the vision of President Bola Tinubu. And when we're talking reforming the health sector, affordability and accessibility of quality healthcare comes to mind. Now, how will this Renewal Compact initiative, bridge the gaps in the health sector?
Thank you, Ruth. So when President Bola Tinubu launched the Nigeria Health Sector Renewal Investment Program in December and signed a compact with all of the critical stakeholders, so the federal government, the state governments, and our large donor partners, the idea was to provide an agreement that serves as a framework for all of the stakeholders to do a number of things. One is to align on a number of national priorities that we're going to focus on, but also galvanize resources, government and non-governmental resources towards achieving those goals. And led by the Coordinating Minister for Health and Social Welfare, the Health Sector Renewal Investment Initiative is being implemented using a sector-wide approach. What that again means is that all of the different pieces of the health sector, the demand side, which is, if you take the primary healthcare system, for example, the demand side is the National Health Insurance Authority working through the SHIAs, the state health insurance agencies, really providing financial protection for Nigerians as they seek basic services. On the supply side, the National Primary Healthcare Development Agency, which I lead, again working very closely through the state and the state primary healthcare development agencies, is really working to make sure that every Nigerian, wherever they are, can walk into a primary health center and access basic services that they need, be it diagnostic services, screening services, treatment services for malaria, for TB, for some of those basic conditions. A pregnant woman can get antenatal care, she can be delivered of her baby. So the things that we're doing really cut across many different, just talking about where we are with implementing the National Health Sector Renewal Investment Initiative. So on the supply side, if you take Primary Healthcare Development Agency, one of the things that we've done is to really improve the Basic Healthcare Provision Fund. Actually, as a whole, the program is being reformed comprehensively because this is money that government really puts into the sector to make sure that the primary health system is working. So the federal government has increased the amount that is going into it. To your point, we have 50 billion. Actually, the budget for 2024 is even more than twice that, which shows the commitment of the government to make sure that the facilities have the infrastructure and the money that they need to operate. One of the tenets of our own work is really improving the functionality, but also the number of primary health centers. We did the analysis. We've now completed an assessment across the country of primary health centers to know where they are and what to do to improve them. And we found two major things that really are related. If you take maternal mortality, for example, the places where maternal mortality is highest, it's really two things among a few other things that drive them. One is just the lack of access to skilled birth attendants, so the human resources for healthcare workers. The other is physical access to the facility. So the farther away you are from a primary healthcare center, the less likely it is that you can receive the care that you need when you're having a baby, and the more likely you are to die. So that really is serving as the thrust for improving the functionality of the primary health centers, but also increasing the number that are supported by the Basic Healthcare Provision Funds, again, in a way that follows the need. So where there are the biggest gaps and where people are not having the access that they need, there are variations across the country. Some countries have quality, some zones and states have more quality issues where it's about investing in improving the quality of facilities. Some have gaps. We need to build facilities.
It's good, Dr. Aina, you're breaking it down for us, expanding the scope, to make Nigerians understand that it requires a holistic and innovative and coordinated approach if we must revamp the health sector. We'll pick up with the conversation when we come back from this break. Stay tuned. Glad you're there. And before we continue with the conversation, we have a report to bring to you. One of the tenets of universal health coverage is access to affordable health care that is close to the people they are meant to serve. In our next report, Chidebere Onya reports that maternal and child mortality remain high due to unevenly distributed human resources and insufficient health care delivery infrastructure in some riverine communities in the South region.
We still resort to the traditional way because there is no health facility around.
The role of primary health care in ensuring that citizens at community level have access to quality health care cannot be overemphasized. However, despite extensive investments by relevant authorities in Rivers State, primary health centers in some riverine communities still grapple with multiple issues ranging from inefficient supply chains, inadequate drugs, to poor health worker performance, manifested by high level of absenteeism and low level of competence and productivity.
Several services have also been included in primary health care to enhance the quality of services that we provide at that level. They are namely mental health, eye care services, and obstetric imaging for ultrasound of expectant mothers.
From Cross River State, Maureen Leo Ajom reports that out of 18 local government areas, 13 local government areas are riverine communities, some of which are far-flung areas, making it difficult for the people to access government social services.
If you go to a typical primary health care center that is within a riverine area that is not accessible, hard to reach, we have drones that are flying right to those communities and dropping commodities.
As reported by a former IHOJ, Bayelsa State government has continued to engage several strategies to revitalize the health sector so as to reach even the hard-to-reach riverine communities. From Akwa Ibom State, Umar Basidate reports that health facilities at the grassroots is a priority for the government.
Some places that also riverine also have security issues.
Health watchers reiterate that President Tinubu's pledge to drive good population health as a tool for attaining economic development is a strong signal that Nigeria is on the path to achieving universal health coverage. In Port Harcourt, Chidebere Onya, NTA News.
All right, let's continue the conversation. Dr. Aina, I'm sure you followed that report, an expose of what people go through, especially in non-reachable areas. But earlier you talked about the infrastructural gap measures being put in place and also ensuring that we have a wider universal health coverage, especially at the primary level. But if the Renewal Compact initiative must be strengthened, then every stakeholder must understand its role. How can stakeholders, work together, build a synergy to bridge these gaps? Because states too have a role to play. They are closer to the people.
Thank you very much, Ruth. What you saw there is quite heartbreaking, but sadly is the reality that many Nigerians have had to deal with. And that is why this government is working very hard to address, among many things, the two major issues that you heard called out there, which I had also mentioned earlier in this report. One of them is the shortage of human resources, but even those that we have are not evenly distributed. And the other is actually access to primary health facilities. Again, most of the things that are hurting Nigerians, that are killing Nigerians, is really at the basic healthcare level. And if we are able to get these services to people in the front lines, I think we will be able to address many of them. I did mention that we are using the health sector, we're using a sector-wide approach, to really bring all stakeholders together. The states they've signed up to the compact, they are stepping up. We are coordinating with them to say, okay, where do we have gaps in service delivery? Where do we have gaps in insurance coverage? We know that there's a lot of them right now, but how do you prioritize? Where are they the biggest gaps? And can we work together so that we can coordinate? If you're providing infrastructure, you're building facilities, if I'm able to give you health workers, you saw technologies being deployed to deliver commodities to the facilities. Our donors, we're even really working with the private sector through a number of platforms, because again, to bridge the gaps in the short term will take a lot of resources. And while government is doing a lot and will do more, our private sector partners and donors are also on board, and we're really just helping them anchor their resources to provide some of these services. Again, if you...
Dr. Aina, what would you say is the next stage? Because from the launch in December, there was a time frame for 4 months, so to say, for the implementation of the Renewal Compact initiative. What next, going forward? Because Nigerians want to feel the impact. Health.
Thank you, Ruth. What we're doing now is really putting those investments out there in those facilities, because you are actually recruiting, you're training. Right now we're training 120,000 health workers who will be redistributed across our facilities working with the states. We're investing in building primary facilities. We're investing actually even beyond primary facilities in revamping the capability of our secondary and tertiary facilities. It takes a little bit of a lead time, but we're pushing very fast, and Nigerians can expect to start to feel the impact of this, in the near future. A month ago, 25 billion naira that people heard about widely in the news was released to go to the facility to give them access to buy some of the commodities that they need locally, but also pay for some of the services. Again, those funds are now going out to the accredited facilities. What we did was to do a reaccreditation to make sure it's only facilities, working with the states, of course, that are actually providing services that we get it, and we're bringing on new facilities as I speak with you. Thank you.
Oh, okay. And also availability of drugs, and healthcare services is also critical, Dr. Aina, not just at the primary level, but at all levels. It cuts across. How can Nigeria position itself, to attract investment for the health sector, to unbundle this initiative?
One of the pillars of the health sector blueprint being led by the Federal Ministry of Health is really to jumpstart the potential of the private sector, the healthcare value chain, meaning how do you bring the private sector to solve some of our problems in a domesticated way. So that, again, if you overlay that with the recent experience where basic medications have skyrocketed in pricing and causing a lot of pain for Nigerians, the minister and the entire health team have jumped on that to do a number of things. One, how do you work with, Mr. President to create that enabling environment to attract investment in local production of basic health commodities. But even those that are here already, how do you empower them? How do you give them access to finance? How do you give them, remove some of the barriers that is stopping them from going to scale? That's, one of the anchors. The other anchor actually is doing some market shaping activity where, pooled procurement, where the government through the presidential initiative on value chain is really looking at what are the commodities that Nigerians are buying the most of and that is causing the most financial pain, and doing some sort of pooled procurement. When you buy at scale, you are able to lower costs and making them available through, last mile distribution channels to all of these facilities and onward to Nigerians. The other thing that I should mention, by the way, is that it's one thing for the services and for the commodities to be available in the health facilities. Is another thing for Nigerians to be able to afford it. So a lot of reforms are also ongoing. First, to rejig the private health insurance space so that many people can actually get access to insurance formally and informally, but also for the poor Nigerians, the vulnerable group fund that the government has set up is really pushing, working again with the states through the state health insurance authorities. This has been anchored in our sister agency, the National Health Insurance Authority, really to give insurance to the poorest Nigerians, pregnant women, children under 5, but also poor Nigerians that are vulnerable, so that when they do access these facilities, they don't have to pay out of pocket.
All right, and if I understand the 2023 to 2027 vision is to see that lives are being saved and, of course, access to healthcare is sustained. Let's hope that those who need to do the needful do the needful. Thank you very much, Dr. Muyi Aina. He's the Executive Director, National Primary Healthcare Development Agency. Thank you for your time.
Thank you.